Well, Majority Leader Mitch McConnell says he hopes to pass through the vote on health care by the end of the week. But for the moment, at least 5 Senate Republicans have said they just can't back the bill. Some conservatives are concerned it's not enough of a repeal of Obamacare, as we heard just a minute ago, but moderates also are not on board, like Nevada's Dean Heller, who's concerned about cuts to Medicaid. Heller's up for re-election in a state that Hillary Clinton carried in the presidential election. And now the pro-Trump PAC, America First Priorities, is going. I'm sorry. It's so funny when you watch somebody like stumble into something. They're just no good at it. They're just stupid, right? It's like a donkey trying to work an iPhone. They're going to actually launch a 7-figure ad blitz. Have you ever seen a donkey try to actually work an iPhone?
Yes,
of course you're not. You're a Yankee, but we see it all the time, right?
In Shrek 7.
Shrek 7, exactly. But they're actually launching a 7-figure ad. Trump against a Republican senator.
Really constructive use of resources.
And it also sends a message to all the other Republicans on Capitol Hill, which is, you know, fine. Okay. Is that how you want to play cowboy? We'll play that way. I mean, Bill Clinton, you could impeach him on a Thursday and he would go golfing with you on Friday because he knew he was always going to need your vote the next week. Anyway, the Washington Post is also reporting, though, that other groups have already been up on the air for a very long time in Nevada with ads like these.
All right, let's get started. You're both over 50?
Yes.
Okay, that'll cost you.
Why?
The new health care bill in Congress. If you're over 50, insurance companies can charge you 5 times more. It's an age tax.
Senator Heller, when this happens,
Okay, I'll be right back.
she isn't thinking about the health care bill in Congress. She isn't thinking that it'll force her to choose between filling his prescriptions or paying their mortgage. She isn't thinking that when her premiums go up, they'll lose their health insurance. And she shouldn't have to. But you should, Senator Heller.
I got to tell you, Elise, our party, if they pass this health care bill, they're going to get routed next year.
Why
We're
do
going
they
to
want to
see
do
this
something
around the clock
that is going to make premiums go up? I just don't get it. Just action for the sake of action, even if it's action that is going to negatively impact your party.
Right. Premiums that go up, everything. Right. Deductibles are worse, rates are worse, everything gets more difficult. Again, for the very people that Donald Trump said he was going to help out, for the very people that, in large part, have been the core of a lot of these Republican support for a very long time. It was the core of my support. The, quote, wine and cheese Republicans didn't vote for me. It was working class, middle class Republicans that voted for me.
It goes back to an earlier point you were making about the kind of conflict between conservatives and moderate Republicans, and you say, well, what's the bridge here? Right. And so the bridge has everything to do with tax cuts, right? The connection between the two constituencies here that are in conflict. So in some ways,
because
the bill
the donor class wants the tax cuts.
It's misdescribed. It's not a health care bill. In some ways, if you look at its particulars, it's really a tax cut bill. And when we look at that, then we can see the kind of moment where the two various constituencies can come together.
But I'll tell you, it's just, I haven't talked to a Republican that says it's worth it.
The Affordable Care Act is a model of clarity compared to this. The Affordable Care Act represents the vision of a relatively unified Democratic Party about how the federal government should interact with the health care markets. I don't understand this piece of legislation. I don't understand how it comes close to representing the conservative vision of lower premiums, better coverage. There is such a vision, but you look at the debate leading into this vote in the Senate. There's no one talking about a vision. What they're talking about is that the loudest voices are the people saying this is a bad idea. Well, I don't hear anybody except Tom Price defending it, and his defense of it is not honest about what it will do.
And so you also have conservative commentators now saying, you talk about the last refuge of the truly desperate, you must vote for this bill or we will not get Supreme Court justices in the future because we will not. No, that's just the opposite. Right. If they pass these bills that nobody likes, then they're going to lose the House and they're going to lose the Senate. Yeah. And, you know, Merrick Garland will be the next Supreme Court justice.
Yeah. Well, look at and think about everything Mark said that's true.
Which would be perfectly fine with most Americans.
Yes, well, certainly. But on top of everything else that Mark just said that's all true, we're not going to get the CBO score today, and it's going to be all of that confusion, all of the arguments not being made, set against some very stark, very large number that's going to not be materially different. Could be worse, maybe, than the House number, which was pretty devastating. So on top of all of that, they're going to have this in the middle of this debate. This atom bomb is going to go off now. That's going to with no positive arguments being made for the bill. You're going to have to see this. It's brutal.
Yeah, Casey Hunt, why? That's a question people always are coming up and asking me. Why do this now? Why force it through? Why write it with no transparency, then try to jam it through the Senate? A bill that's going to be wildly unpopular.
The conventional wisdom coming out of McConnell's office and other leadership offices seems to be that they feel like it's much more politically wise to do something than nothing, no matter what that something is, if they don't follow through on this after all these years. But I have to tell you, Joe, I do think that there is something of a fundamental misunderstanding of what's going on in the electorate. And we talked about this over and over again when President Trump won and everybody was so surprised. Not everybody on this show, obviously, but a lot of people were very surprised. The Democratic Party is moving way to the left on this issue, way over towards single payer, way farther than where they were when they passed the Affordable Care Act in the first place.
Right.
And all these new Republican voters that backed President Trump, they are not looking for policies like this. And while, yes, Trump ran on repealing Obamacare, he also promised not to touch Medicaid, not to touch Medicare. That's what I don't understand completely, the disconnect between what the president thinks of this and where Republican leaders are. It just does not seem to me that this is a bill that this president ran on in 2016.
Well, it's not. You can go down the list of the promises Donald Trump made, and it's just objectively, you can line them up here, and everything he promised to voters in Wisconsin, Michigan, Ohio, and Pennsylvania, he's violated with these bills. And on top of that, Eddie, only 14% of Americans support these bills. And we don't even have the CBO numbers out on the Senate bill. It's probably going to be even worse.
And we look at the folks who are going to be devastated by it if it's passed. We think about half of America's children are on Medicaid. We think about close to 40%. Our births are on Medicaid. About 40% of America's children are on Medicaid. You think about poor folks, particularly in the South, where we're from, are disproportionately on Medicaid. It's going to devastate the folks who voted for them. So it doesn't make any sense.
And Elise, if I'm a conservative on the floor and I'm going to go out and vote for my party's bill, it better give me something I can go back to my district who's saying, listen, I know this is tough medicine and not everybody is going to be helped by this bill, but this is what the bill does. It's actually, it brings in free market forces, and most importantly, it lowers the cost curve for our healthcare industry over the next 20 years and stops us from becoming bankrupt. This bill doesn't do that. It doesn't bring in free market forces. So even as a conservative, where I might be willing to make some really tough calls on one side if I get something back on the other, this bill doesn't even do that. It doesn't make the system better. We still careen towards bankruptcy. All it does is it transfers wealth, about $1 trillion in wealth, from the poor to the rich.
And how disturbing is it that this is going to reorder a sixth of our nation's economy at a time when a lot of people are really struggling, and they're doing it without any real debate, and they just want to jam it through, get it done before 4th of July.
Right. And we have, Casey, we have so many quotes from Republicans who were concerned about Barack Obama's administration not being transparent about their health care bill. You can go back to '93 and have all the Wall Street Journal editorials attacking Hillary Clinton and the Clinton Care Commission for not being transparent. And my gosh, the complaints in '93, the complaints again in 2009. And yet here, this is the most secretive, closed process we've ever had for health care reform. There's not even a close second. And yet, they push ahead.
Look, I covered all the markups for the Affordable Care Act. All the hearings, I mean, hours and hours and hours. And at the end of the day, yes, they cracked the final deal behind closed doors in Harry Reid's office. And as we know the story, they passed it on Christmas Eve. But it was after a year and change of debate and discussion and back and forth about the public option, tax credits, this, that, the other thing. This is a very, very quick process that has involved a very small amount of people, to the point where, you know, those of us who've covered this as a policy issue for years aren't even quite sure the right question to ask when they come out of those rooms, because we don't know what they're talking about. And there are Republican senators who are essentially saying the same thing about it. And I think that's the thing to watch this week, in my view. You heard Ron Johnson say it over the weekend that what they want to do here is delay this. If you start to get more Republicans who are saying, look, I just don't want to do that this week, yeah, it'll be a delay, but it's potentially also a death knell for the bill, because if they delay it past this week, and McConnell knows that, that's part of the reason for this quick timetable. They're going to go home for the 4th of July recess. You're going to see all of these kind of town halls, a lot of anger, and a potential sapping of the political will. And then all of a sudden, you're in August and September, and we're back to governing by crisis.
It doesn't work that way. At the front of the Daily News, one of the papers that the President of the United States reads, has the headline, Revolt. We're not quite there yet, are we, Casey? Not quite yet,
no,
a revolt, but they're starting to move away from it, aren't they?
I think that you are seeing some early signs that there are people who at least feel like, okay, let's just take a breath, let's slow this down. And if that starts to become the most predominant narrative, I think there is a risk that leadership will have to put this off. And if they do that, it could have more far-reaching consequences than just what it sounds like.
All right, and one more piece of information on the story. The most recent Kaiser poll is now showing, for the first time in 79 polls, more Jedi mind tricks. Support for the Affordable Care Act has passed 50%. Well, just 30% of Americans support replacement plans. Look at that. I mean, again, so his Jedi mind trick isn't just, it was not just specific to the President of the United States. He comes back and...
This Republican bill is apparently not repealing or replacing Obamacare, not presenting a free market future for health care, not doing anything. It is doing one thing, though. It's making Obamacare more popular.
Making it much more popular.
Wow.
Yeah.
Great job.
Strong
Job, Republicans.
Yeah. Strong with a force, this one is. Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.